Welcome to the second video in the Our Faith, Our Vote Issue Education video series. The United Church of Christ's Our Faith, Our Vote campaign is designed to equip the faith community for nonpartisan engagement in the elections through voter registration, issue education, and voter mobilization. We hope you will use this video and others in the series to get informed about the issues at stake in the elections, issues that our faith calls us to address. In this video, we will discuss the topic of healthcare with the help of our domestic policy advocate, Katie Adams, and Health Liaison for Wider Church Ministries on the Humanitarian Development Team, and the convener of the Racial and Ethnic Disparities Taskforce, Barbara Baylor. Prior to this, Barbara Baylor previously served for 18 years as Justice and Witness Ministries, Minister for Healthcare Justice, and as Domestic Policy Advocate in the Washington, D.C. office. Barbara has a master's degree in public health from the Gilling School of Global Public Health from the University of North Carolina at Chapel Hill. She served as the American Public Health Association's 2013 Brookings Institution Congressional Fellow from January to December 2013 in Congressman Charles B. Rangel's office. So great to have you both here. So Katie, I will pass it to you.
Thank you so much, Jessie. And thank you so much, Barbara, for joining us for this conversation. I really look forward to hearing what you have to say and for the opportunity to have a conversation about the importance of engagement in elections and why people who care about healthcare and access to healthcare should be engaged in the election process. So I'm just going to launch in with our first question, and it's a big one. We both know healthcare is a issue facing us and future generations. So as we think about going to the polls in November, what should folks be asking their candidates to ensure that those running for office are thinking about healthcare solutions that work for everyone?
Okay, first, I want to again say thank you, Katie, for giving me the opportunity to be a part of this webinar on a subject that has been near and dear to my heart for a long time. So thank you. And I hope you'll just allow me just to backtrack just a second, because what I want to say is happy anniversary to the Affordable Care Act. This is the 10th anniversary, so I want to be able to say that. And the Affordable Care Act, as both of you know, was very successful at providing insurance to approximately 20 million people, and we still have that intact at the moment. It expanded Medicaid. It established the very first public health prevention fund for our communities, and it provided access to health care and addressed a lot of the issues that people were very concerned about at that time: coverage, preventive care, and especially for pre-existing conditions. So I want to just give a shout out to the ACA and all of those people that have benefited from the ACA. The other thing I want to say is what would happen now at this juncture in time if the Affordable Care Act is repealed. If it is repealed, people will immediately feel the effects of that, and that again, those 20 million people will lose their health care coverage at some point, and the impact will be felt rather quickly. And also states would lose a lot of money, about $135 billion in losing the federal funding for Medicaid subsidies that have helped a lot of people during this time of the Affordable Care Act. So that's one thing I want people to keep it in mind, and for people that were choosing healthcare in the marketplace. But there's a lot of other consequences. I won't go into all of those, but that's one of the big things. Immediately, you would start seeing that people would no longer have that healthcare anymore. I mean, you would take away. A lot of people love the fact that the pre-existing conditions, I myself, if I was, using the Affordable Care Act from a subsidy, a marketplace, that would be one that's near and dear to me, and probably many of you. It was losing your pre-existing conditions. The lifetime caps would disappear. That's another thing. If the caps were lifted, that means that people would have to pay for procedures and out of their pocket, their own pocket, and they could hit that limit An insurance company would say, we know that's it, and they'd have to be paying for the full price of their health care. The other thing is, if health care is repealed, if the Affordable Care Act is repealed, the so-called, what we call skinny plans will become more popular. Those skinny plans were plans that had minimal coverage, but they cost less. But these skinny plans were also not, they were exempted from providing the 10 essential healthcare benefits, and I won't go into that. But there were key things. One was hospitalization. Another one was lab tests. Another one was chronic disease management. Another one is emergency service. So there were 10 services that we will lose if the Affordable Care Act is repealed. So one of the things that we want to ask our candidates who are running for office at this time, one of the first things that I always want to say is, how do you really feel about healthcare? Do you believe that healthcare is a human right? I like to always hear people's answers for that. Do you really believe that this is human? Because a lot of people think that the only way that you should be rewarded with healthcare is if you got education, if you're working hard, if you have money, if you have wealth. That's why you deserve to have healthcare in this country. So that's one of the first things that I always like to ask them. Another thing is, would they fight for the protections of the Affordable Care Act? That's very important to me. And also restore the protections that have been dismantled already by the current administration. And another thing that I would want to ask them at this point about healthcare is their stance on abortion and reproductive rights. Congress could repeal the restrictions on what federal funds can pay for. And we want to make sure that we're preventing states from passing laws that restrict access. So I want to know from them, are they willing to stand up for that? And then another thing that I would want to know is, how would they address health disparities in this country? And I'm going to talk a little bit more about that on one of Katie's other concerns. But would they retain the provisions in the Affordable Care Act that provided funding to the community health centers? That's what I meant before with that public health prevention fund. So a lot of racial and ethnic groups use community health centers, and we want to make sure that whoever we're electing is going to push for keeping those community health centers open and restore that funding, because a lot of the funding, they have taken away a lot of the funding from the public health prevention fund. And then another question that I would ask to our candidates is their thoughts and feelings on Medicaid and the Children's Health Insurance Program. We have seen that coverage decline from both those two programs. And as a result, there's been an increase in a number of children who are uninsured. So we want to make sure that they would be pushing for Medicaid, the funding to stay or to be put back for Medicaid and also for the Children's Health Insurance Program. And so toward that end, we would want people to really push these candidates, if they were to be elected, to push for prioritizing public health legislation, and to make sure that they're looking at putting in family and medical sick leave and family leave, and just looking at that whole health infrastructure and the system to make sure that it's working properly for everybody. And then the other thing is, I would want them to be pushing for saying yes to dropping the case to eliminate Affordable Care Act if they were elected. That's the main thing I would like for them to be doing, and to be urging their fellow lawmakers, and also to put some pressure on the Supreme Court to keep the ACA, because Americans cannot afford to lose access to their health care, and especially in a time, I'll be saying more about this, when we're experiencing the greatest pandemic in the entire country. So we wouldn't want that. And they wouldn't be able to get, or probably not easily able to get a vaccine once that's approved, and also general health care. That's all of that related to COVID-19. And then the other thing, as I mentioned before, is urging them to work with local organizations to respond to those governors who have not expanded Medicaid. I'll say a little bit more about that in a minute. But so, and urging them to not vote for these candidates if they're not going to stand up for the Affordable Care Act. That's really the bottom line. If you not vote, I'll vote for somebody else. Do that. So, some of the things that have already been removed from the Affordable Care Act is that new rule that we just heard about. I guess this was just last week, Katie, I believe. That they removed the Obama era regulation that removes protections against discrimination based on sex stereotyping and gender identity. I would want to see them reverse that, put that protection back in there. So that's pretty much what I would say, but mostly making sure that they do have the heart and believe that healthcare is a moral imperative for everybody.
Thank you so much. I really think that driving home the importance of the Affordable Care Act and the significant challenges that people would face if it were repealed is something that I'm hopeful that people take home with this. And there's so many issues that feel kind of amorphous to people, but healthcare is unique in that it touches every person. Everyone in the country will at some point interact with the healthcare system. But I think it's critical to remember that depending on who you are, your access is dramatically different. And we in the US have the unfortunate distinction of having one of the most expensive healthcare costs in the world without having corresponding good health outcomes. And there's so many disparities in infant and maternal mortality, life expectancy, risk for chronic health conditions. And so I think that really shoring up and assuring that people have access to the Affordable Care Act and instituting legislation that makes it even more responsive to what people's needs are is really important. So those were a list of excellent questions for candidates, and we have some of those available on the healthcare one-page sheet that is attached to Our Faith, Our Vote. So I think it's intimidating sometimes for people to go out and interact with candidates. So we've tried to make it easy and provide just a one page that they can print out, sit with them on a virtual town hall and look at and say, okay, here's some questions. So I'm grateful for that really robust and helpful list. Like I just talked about, healthcare inequity is something that, has existed, but COVID-19 has highlighted that inequity across the board. As faithful advocates, who are engaged in healthcare justice, can you talk about communities that are particularly vulnerable and at risk from experiencing from these existing disparities and in its relation to COVID-19?
Sure, I'll be glad to. I want to share with people who may or may not know that in 1985, the Secretary's Taskforce on Black and Minority Health, as minority was the word that they were using, back then, Black and Minority Health, that marked the first convening group of government experts to really conduct a comprehensive study on racial and ethnic minority health, which elevated, at that time, minority health to the national stage. But here we are 35 years later. And despite the progress toward ending health disparities, racial and ethnic groups continue to face significant health disparities. Isn't that something from 1985 now? It's there. So I want to let people know what health disparities are. They are really differences in the health status that are linked to social, economic, and environmental disadvantages. So health disparities affect a group of people who have experienced greater obstacles to health based on their race or their ethnic makeup, religion, socioeconomic status, gender identity, mental health, sexual orientation, or their geographic location, or other characteristics that be linked to discrimination or exclusion. So that's what health disparities are. And historically, communities of colors have experienced disparities that include the things I just mentioned, and also political factors that have put them at higher risk of chronic conditions that leave their lungs weak and immune systems compromised. They have higher rates of asthma, heart disease, hypertension, and diabetes. And I want to stop there just for a second, because there is a resource that I've used a lot, and that you can, there's a training behind it called Racism in Medicine. And in that book, it's from the National Medical Association, which is largely of the African American physicians in this country, put that together to show you from slavery to this day what has happened. People say, well, why are the health so poor? But from slavery to this day, there were conditions put in place and experiences that slaves had. Even when they brought to the New World, they weren't able to get proper healthcare treatment under Jim Crow laws. And that's a whole other thing, Katie. Maybe I can come back and talk about that, the racism in medicine. But certainly, redlining and environmental racism is another reason that racial and ethnic minority groups have poor health. A lot of racial and ethnic minority groups have been relegated to and segregated in housing, dirty air, pollution, contaminated water, and food deserts, and exposed to more racial discrimination and systemic and structural racism as well. So that's some of the reasons for historically why racial and ethnic minorities have poor health. Now, related to COVID, African Americans have the highest death rate due to COVID. And Latinx populations have the highest rates of infection of COVID. So that's something I need to know. More than 20,000 Black Americans have died already from COVID-19. They have less quality, all racial and ethnic minorities have less quality health care, and not only health care as an access piece, but also as delivery and treatment. That's sometimes we forget that. And I use a term a lot, benign neglect, when it comes to delivery of treatment. But sometimes, and this is not all doctors, but sometimes, doctors will kind of dismiss concerns that racial and ethnic minorities have, and not developing what I call like an intentional plan to really figure out what is happening with that, but usually just general things. And sometimes that can dismiss things that are happening with us. There have been some examples already that we've seen in the news where people of color have gone, they felt like they've had these symptoms from COVID, and they've gone to the doctor and say, oh, there's nothing wrong, go back home, sent back home, and then later on they've died. So that's an example of what I mean by a benign neglect. Not really an intentional listening ear and listening, that kind of thing. So people of color, they also are disproportionately represented in frontline jobs as far as COVID is concerned. And so that can't be done from home. Like you and I have the privilege of working, from home. A lot of people cannot do that, work from home. And that increases their exposure to the virus. They have high rates of poverty and low wages that people feel compelled to leave home to go to work because they have no choice. They have to eat, they have to provide for their children, they need daycare, and all kinds of things that. And I mentioned this before, that people of color reside in densely populated areas in the country. And there's really no way for them to shelter in place properly, as we've been saying. And then what we're finding out now is that the people of color reside in the 5 areas in this country, of the most densely populated areas in this country. They're relegated there. Again, racism continues to be a driver of the systemic, and COVID has it's exposed all of these. It's really, like I said, people have been saying all the time that this is not anything new, but it's just bringing these out. Historically, inequities in our system. And the safety net, the fraying of the safety net just really makes it easy then to spread for the virus to spread in communities of colors. Another thing is the unavailability of testing and inequality in testing that has caused the disease to spread undetected. So what we've been asking for, and there is a sign-on letter to this effect, for people to let their governors and their public health departments please implore them to please do the data on racial and ethnic minorities. They weren't collecting that at first, but now they're doing much, much better. And you can see that that's one reason the numbers are getting higher, but to me, that's good. I know the president might disagree with me, but to me, that's good, because we need to know who's infected, and so how we can how we can treat them. Even though we don't, in lieu that we don't have a vaccine right now, but we still need to know, and we need to increase the testing in more community hotspots. Like, a lot of people weren't able to get to the testing centers, so now they're starting to do more testing right in the communities, which is good. The mobile testing. So and added to that, I mentioned this a few minutes ago, but we want to make sure that our governors are expanding Medicaid. We have 14 states, and I live in one that has not expanded Medicaid. And with the strains on the system right now due to COVID-19, and it's just taking a deadly toll on people who have COVID-19, and you see hospital beds are being full. The system cannot take it. So we need to make sure that Medicaid is expanded in those states, so that we're not leaving anybody out, and so that we don't want to see costs rising and continuing to burden the system more. So,
yeah, I think one thing that people have seen is the importance of our local lawmakers on, during COVID-19. So while, in the Washington office, we so often talk about federal legislation, looking at, elections aren't just about who's president or who's, in Congress. It's about our mayors, and it's about our governors, and it's about, our DAs and our sheriffs, and it's about the people who are in your community who are making decisions about access to care and so many other things. You've just so ably described something that's not a surprise to people who have been heavily involved in healthcare work, but the idea that, our social safety net system really, it's fraying, but it was fully in the first place.
Yeah, it was.
And so, it's not a surprise to many of us who have been, deeply ingrained in this space like you, that, when hit with something smaller than this would have, really, really frayed the system, but hit with something as big as a global pandemic. I really appreciate you calling out the intersections of access to care and racism in the U.S., because it's not, it's something that I think a lot of people gloss over, and they don't listen to closely enough. And so, it's an intersectional, we can't just talk about police violence. We can't just talk about, health, access. So thank you for. So
let me say one other thing. I'm just saying, the other group, and as I talk about the racial and ethnic groups in this country, within the groups, like in the African American community, we talk about, women of color are really burdened by COVID-19. There's, women have, they're single families headed by women. Women also make up this large voting bloc too. That's the other thing. And we need to make sure that we're doing everything we can so that they are keeping their jobs, because a lot of women now are out of work, they've been furloughed, or they've either been let go, from these jobs, and we don't really know whether or not these jobs will be returned, at such a time when You know, things really are open. So I want to say that. And also in terms of access to care and health and delivery, a lot of people think, well, if you get education and you have enough, you know, money, then you ought to be able to be healthy and get the best health care. But what we see oftentimes is that even controlling for that there's still this gap in health outcomes, especially for women of color. So I wanted to go back and say that as you mentioned that, Katie. So women, really, we need to be concerned about women, and we need daycare. They need daycare, and all the daycares right now are closed. I'm thinking about my daughter, who's a teacher, and of course the schools are closed, but we have a 4-year-old. She just turned 5, and being with her, you know, all day trying to figure out what to do, because the daycare, the preschool was closed. It's been a challenge. Sometimes she's with me, you know, I keep her alive, and she's full of energy. So you can just imagine what mothers are going through. And even when there is a father in the family, sometimes just trying to figure out, you know, what to do with the children. Because even my daughter and her husband, they also have 3 boys, and they're just like wanting to be out playing basketball and here and there. And they don't understand why the parks aren't open, and I don't see why we just can't go out, and we're not letting them go out because we don't want anybody just saying, oh, these boys are out in the street. See, that's another thing, that when I say healthcare is intrinsically tied to the racial injustices, you saw what happened. I know I'm veering off a little bit, but you saw what happened in Atlanta yesterday, where the boys were out playing, and they had, I guess one of them had a BB gun or something. Anyway, they called the police on them, and there they are with their hands ahead and a gun being drawn on. So we try to tell our boys that you just can't be out running around the street, you know. So the children are really being affected by this COVID-19.
Yeah, and that's healthcare too.
Yes, it is.
Yeah.
The mental of that. Yeah.
One of the things that as health advocates and also people of faith that I find so important is we're here, and we, you know, people of faith are on the ground, and they're hearing these stories, and they're hearing what's happening in their communities, you know. So they're talking to your daughter, and but faithful advocates hear the stories of their communities and congregations, and I think have such a unique voice in policy advocacy. And so when we talk about, you know, advocating for healthcare, when we talk about talking to our candidates, I think it's so important that people of faith show up and say, we care about this. And, you know, the United Church of Christ has been really involved in healthcare advocacy as, you know, a right and priority for everyone. You know, like you just talked about, people kind of have this attitude of, well, if you work hard and you've got money, you know, you can get access to the care you need. And we say healthcare should be a right for everyone, regardless of, you know, financial barrier, and that everyone should have access to equitable and comprehensive healthcare. So, you know, as you're advising faith advocates who engage in healthcare advocacy, how would you, you know, advise them to engage with candidates? From your time doing this work, what challenges have you seen that have existed for advocates?
Okay, that's a really good question. Excuse me, Jesse. And I, as I was thinking, when I saw that question, I was thinking about it. One of the things that came to my mind was that at the time that I was there, you know, and working for healthcare reform and healthcare justice, many of the denominational offices and faith offices had a key person working on healthcare, like one only. Like I was that was my you know, entire job, working on healthcare, and that made the work easy to come together. And I was part of the 2 or 3 denominations that came together right in Cleveland there that formed Faithful Reform in healthcare. And so that became sort of like the leading voice of first on a state basis, and then on a national basis. And so we had a network of people that was dedicated to healthcare. And so we were able to pool all the resources, all the wisdom, all the knowledge from all the denominations. We wrote articles, briefs together, one pages, everything we did, and we shared that. That's a key thing right there. We shared our work. So like if I'm United Church of Christ and I wrote something, I could give it to Lutherans, Presbyterian. We were all there. And as Katie, as you well know, right there in the office, right there in your building. So that was very, very important. So we advocated together. When we said we were coming to Washington, we always were there together, and we were able to march and pray and talk about why this was so important. But now we don't necessarily have that same kind of setup. So what's going to have to happen is we're still going to have to come together in collaboration. Now that's the key thing: collaboration and partnership from in your own community. So now you don't have that one organization here at the top that's saying, well, do this and try this and try this. Now you're going to have to be if you don't have a person at the denomination level, you're going to have to, local churches are going to have to figure out how they're going to band together locally with other faith organizations to form a health committee. I'm just going to say that, a health committee. And for dialogue and education and action on issues around healthcare. And another thing, Katie, that I think is real important in advocacy right now, as it was then, right now, it may be even more important, is finding agreement and consensus on the language of healthcare. And that, we talking about healthcare as a moral imperative, as we value the lives of everyone, and it is a human right. And it's important for churches now, faith community now, to carry that same language. So I can't just say that, we just can't say that from the UCC, but we got to make sure the Lutherans are saying it, the Presbyterians are saying it, everybody, so that legislators hear that same language. I think that's an important piece of advocacy. And I mentioned before, joining coalitions with community organizations that are on ground that are working on this issue. Continue to plan letter writing campaigns and call-ins. And what I like to do is keep up with the state legislature. I try to give input where I can and stay up on what's happening in my state. And then if there's a rally or if there's an advocacy march or something, I sign up to go. So I'm saying without the fact that we have an organization at the top, as I said before, like Faithful Reform, that was helping us put all that together. Now churches are going to have to be much more intentional about forming their own partnerships and forming their own coalitions to do that. And be more intentional about talking with your local officials on your state and local levels about this issue. And the other thing is sharing your personal story with your legislators, and how ACA impacts your life, or how healthcare impacts your life. And because people like the stories when they read a story. And also writing to the newspaper, which I'm right now trying to pull together some of my public health friends, and we're thinking about writing a letter to the editor just about President Trump's pulling out of the World Health Organization. See, that's another big thing to me that we won't go there right now, but that's another big thing to me. And I'm very concerned about that. I really am concerned about that. So those are just a couple of things. And now, of course, as both of you know, everything cannot be done in person yet. So the other thing is that one of the challenges right now that I see faith community is learning how to do Zoom. Learning how to do the Zoom, and helping people get training. And that's for the United Church of Christ. We're glad we have you, Jesse. They're helping us, to do that. And so planning a Zoom webinars and Zoom meetings and learning how to do that, and being intentional about how we're going to have a healthcare conference call every Tuesday or something like that, whatever it is. So, but the advocacy piece needs to now also be individual, unfortunately, because we can't get out as much as groups. So you're going to have to figure out how we're going to do that calling. I was making that joke yesterday, Katie, about me writing the senator here. He never writes back, but and I'm going to have to figure out how I'm going to be more intentional about getting him to hear me. So, but as a group, I think just faith community, joining your local coalitions, local with other denominations and other faith organizations, and to really begin to look at what some of these issues are for our country around healthcare.
Well, and I think we've seen that faithful advocacy works. You know, the Affordable Care Act was saved over and over again. And, you know, when people show up and they vote for things and they, you know, speak about issues that they care about, it feels like a slog, because it is.
Mm-hmm.
We know that all of those calls are counted, all of those letters are counted, all those emails are counted. And it's hard. I get it, because there's so many issues and they are so varied, and in the healthcare space, they cover such a wide swath. But it's, you know, it's those intentional, thoughtful actions, like you mentioned, you know, being really focused, that really brings change. Those are such great suggestions. And I'm, you know, as the UCC DC office, you know, we work on healthcare issues and, you know, are really eager for people who, you know, have their, you know, healthcare groups in their congregations to partner with them and help them, you know, come up with ways to do advocacy, ways to talk to their candidates. And, you know, we have a lot of resources on the Our Faith, Our Vote page. You so ably talked about, you know, some of the risks that people are facing, how voter turnout could affect access to care, or the risks if people don't vote. Are there any other kind of, you know, what's at risk if people don't vote?
Mm-hmm.
that you want to?
That's a really good question. And I was thinking about it, and I'm going to share what I thought, but just what popped in my mind just you said that second you said that was a group that had a sign on Facebook recently. You may have seen it, but I think it was from 2016, but it was saying that if black lives don't matter, I'm not voting. And so many people wrote comments, you know, about that, how that didn't work in 2016, and that won't work this time either. If you don't vote, you'll see you're going to have, nothing's going to change. And in fact, it's going to get worse. So voter turnout, you know, in my mind is important legislation, like it is it important, like in the legislation of the Affordable Care Act, which I believe led to many people participating in elections, because it was just that important. But if we're going to try to save the Affordable Care Act at a time when we do have this a pandemic in our country, I think that alone by itself is going to increase the voter turnout. And people are connecting that. Elections, COVID, what's happening at the top right now, I'm going to vote. And also added to that, the racial violence of Black and brown people in this country is also going to raise voter turnout. As I said before, health injustices are tied to racial injustices. So but here's the thing, if people don't vote, they are going to risk the opportunity to participate in the debate that by electing, you know, representatives and candidates that will steer the health policy in the way we want it to go. But if they don't vote, then that candidate is free then to steer health policy in their own views or the way they think. And it may not be what I'm saying, may not be what I believe. So that's another reason that we can't stay home and not vote. We have to vote. And then voting barriers disproportionately affect people of color. Like, for instance, and I'll just use my state as an example, state of Georgia, where there has been lots of voter suppression activities and other barriers to voting. As you've been hearing, it's been making national news about all of the machines and things being down. So that's disproportionately affecting people of color, and that's gonna reduce the chances of passing legislation that's important to people. For instance, I'm going back to the Medicaid expansion piece again. If you have large numbers of people who are impacted by Medicaid and they cannot vote, then their voice is not going to be heard, and that's not going to translate into candidates voting for increased funding, that's going to be needed for Medicaid. That's going to then translate into healthcare access and delivery and treatment for people that have COVID. So that's just an example. But that's how I feel about that. And so they cannot vote, and then their voices won't be heard, and then things are not going to change.
Yeah, I mean, there's concrete links, in states that have barriers to registration and barriers to voting. They also that disproportionately affect people of color. You see reduced chances of Medicaid expansion. Direct links to access to voting and then access to healthcare are pretty stunning. And I think it shows one more reason why people are making it harder to vote in a lot of places. And it's that intersecting links between access to care and someone's like, well, why would access to voting relate to Medicaid expansion? And it directly does.
Because if they're not voting, then legislators are not hearing that that's important. So then they're like, well, I don't have to. I'm not saying that they're saying that, but it's like, well, I don't really have to do anything then, because it's not. I'm mostly concerned about people who are wealthy and people who have health care already, so they don't have to listen to that. So that's why that's really important.
Yeah, you've said so many great things, and we've had such a great conversation. But one thing that you want someone to walk away from this conversation, to go tell their congregation, go tell their friends and family? What's the takeaway that you want them to have?
Okay, the takeaway that I want people to have is what I ended the meeting with. Katie, you were there yesterday, because it's so important to me, and I'm just going to read this.
Great.
The choices people make are constrained by the choices people have, and that comes from unnatural causes. Is inequality making us sick? And there's many threats, such as COVID-19, that have nothing to do with our individual choices. There are historical realities, there's genetic realities, environmental realities, structural and systemic racism realities, health access and delivery realities that cause us to be burdened with excess disease and death. So we must join with a collective voice and a collective response to make sure that everyone has the opportunity to attain their full health potential, and that no one is disadvantaged from achieving this potential because of their social position or other socially determined circumstances. So what I want to say is that we need to be standing up, we need to be speaking out for healthcare and racial injustices together, because that is critical as we continue to battle COVID-19. So please register and please vote.
Thank you so much. That's exactly it. I'm hopeful that people share this video and share that message. Register to vote. We have so many resources available on Our Faith, Our Vote, and you're an incredible resource. So thank you for taking the time to share with us and to have this conversation. Back to you, Jessie.
Thank you, Katie. And thanks, Katie, for kind of directing this conversation. And Barbara, thank you so much for joining us and sharing your wisdom and your voice. It is so much appreciated. Thank you to those watching in the Our Faith, Our Vote issue education series. We hope you'll use this information to inform your participation in the election season, and that you'll share what you have learned with others in your congregation and in your community. Please take a look at the other videos and resources on our website at ourfaithourvote.org. Thank you for watching.